Multiple endocrine neoplasia MEN syndromes are inherited disorders that affect the endocrine system. There are several types of MEN syndromes, and each type may cause different conditions or cancers. MEN1 syndrome usually causes tumors in the parathyroid gland, pituitary gland, or islet cells of the pancreas. Multiple endocrine neoplasia type 1 MEN1 is an endocrine tumor syndrome caused by inactivating mutations of the MEN1 tumor suppressor gene at the 11q13 locus. Although usually inherited as an autosomal dominant disorder, MEN1 can also occur sporadically, without a family history, as a result of new mutations. MEN1 predisposes to the development of tumors in target neuroendocrine tissues. Type 2 multiple endocrine neoplasia MEN2, in contrast, is caused by mutations in the RET proto-oncogene and typically presents as medullary thyroid carcinoma, hyperparathyroidism, or pheochromocytoma. Primary hyperparathyroidism, due to hyperplasia or adenoma of parathyroid glands, is the most common manifestation of multiple endocrine neoplasia type 1 MEN1 and occurs in approximately 90% of all patients. Pancreatic islet cell tumors represent the second most common manifestation of MEN1, occurring in 30 to 80% of patients. Islet cell tumors encompass the following: gastrinomas, insulinomas, glucagonomas, vasoactive intestinal polypeptidemas, VIPomas, pancreatic polypeptidemas. MEN1 associated anterior pituitary tumors most commonly secrete prolactin 60%, followed by tumors that secrete growth hormone 25%. Less than 5% secrete corticotropin, and others are non-functional. The putative gene for MEN1 has been localized to band 11q13 and codes for the menin protein. Menin is involved with regulation of transcription and genome stability. Loss of heterozygosity for this region is associated with MEN1, suggesting that the gene has tumor suppression function. MEN2 can present with a sign or symptom related to a tumor or, in the case of multiple endocrine neoplasia type 2B, with characteristic musculoskeletal or gastrointestinal findings. Medullary thyroid carcinoma (MTC) represents the most frequent initial diagnosis. Occasionally, pheochromocytoma or primary hyperparathyroidism may be the initial diagnosis. Pheochromocytoma occurs in 33 to 50% of MEN2 cases. In MEN2A, primary hyperparathyroidism occurs in 10 to 50% of cases and is usually diagnosed after the third decade of life. Rarely, it may present in childhood or be the sole clinical manifestation of this syndrome. MEN2A associates medullary thyroid carcinoma with pheochromocytoma in about 20 to 50% of cases and with primary hyperparathyroidism in 5 to 20% of cases. MEN2B associates medullary thyroid carcinoma with pheochromocytoma in 50% of cases, with myrphenoid habitus and with mucosal and digestive neurofibromatosis. Thank you for watching. Subscribe our channel Medical Spirit for